Well, the Regenstrief Institute and the Indiana Health Information Exchange have been working on health information exchange for well over 15 years now. And as a result of that, we've stumbled through some of the challenges with reaching sustainability. And most importantly to those, I think, is creating services that are of direct value to the various participants. So our funding model, our sustainability model, is one in which we look for a mixture of services targeted at different constituencies, providers, laboratories, healthcare payors, that creates a value proposition for them, and then try to price the services in a way that are appropriate to the value achieved and the cost of providing that service. So the short answer to how we approach sustainability is a patchwork of multiple services, each targeted at the appropriate participant in the healthcare delivery chain that creates value for everybody. And that's, I think, the only long-range way to make it work. The Indiana Health Information Exchange and the Indiana Network for Patient Care are query-based services, if you will, do not include any charges to clinicians who access the system. We try to create value in other ways so that the clinicians who are taking care of patients and using that information day to day are able to take full advantage of it without hesitation. In order to be sustainable, the services that a health information exchange delivers have to create value. And so we select our services based on a model that looks at the cost of creating those services, the cost of maintaining those services, and then the likely revenue that we can generate from them. That's one of the reasons that we started with clinical messaging, results delivery, where we take a result from a laboratory, a radiology center, or a physician practice, for example, and deliver it to the clinician. That's a service that has high value to the participants because doing that work without the health information exchange is very expensive. In our initial assessment, it cost 81 cents for a hospital ancillary service to get a result to the physician's desktop. And we do it for much, much less than that, resulting in literally millions of dollars of savings per year, in addition to helping sustain the overall exchange. So that's one service that we offer. A second service that we offer is the INPC, or the Indiana Network for Patient Care, which is the patient-centric view of the data. And we have a different business model for that. We also have a major investment in developing our Quality Health First service, which is a service targeted at the healthcare payors, both public and private, who value our ability to generate in a transparent, neutral way quality measures and provide that feedback to the clinicians who are caring for their beneficiaries as well as to the healthcare delivery payors, because they have no other way to get that information at a granular physician-based level at a scale which is meaningful, enough patients per physician in order to give them a good measure of quality. And then driving, with the physician's cooperation, quality improvement across the community. So that's a third service. We also offer through our FAS program, the Public Health Emergency Surveillance System, which Regenstrief Institute administers, support for public health functions such as syndromic surveillance and electronic laboratory reporting. And fortunately, our state health department has been very forward-looking and able to help invest in those services and support the exchange over the long run by leveraging the benefit that they achieve through those services. Anybody who's trying to do health information exchange today is faced with many challenges. One of the biggest, perhaps, right now is finding qualified personnel, both at the management level, the technologic level, at the clinical knowledge level, at the customer support level. Those are all challenging positions to fill. And especially with the stimulus and the Accountable Care Act, the demand for those people throughout the country has skyrocketed, making that even more challenging. So that leads to a second challenge or barrier for us, which is careful prioritization. And that can be very difficult because that sometimes means that we have to ask potential participants in the exchange to defer their goals and their needs because there simply isn't enough personnel and talent to satisfy those needs in the near term. And then I think our third biggest challenge is really around driving additional business value, creating well-curated, normalized data is a very expensive process. And if you want to support that, you need to have a lot of different services or lines of business. And in order to develop those lines of business, you have to carefully prioritize them and invest in the contracting and the business modeling and so on that goes with those. And so that's really our third biggest challenge, I think, as we try to expand on the work that we've done over the last decade or so. The federal stimulus program, the HITECH Act, specifically created a number of programs that are targeted at improving and enhancing the adoption of health information technology and health information exchange, with the goal of increasing the number of citizens in the country who have an electronic health record, who benefit from an electronic health record. Two of those programs are the regional extension centers and the State Health Information Exchange Cooperative Agreement Program. In Indiana, Purdue University is hosting our Regional Extension Center, which is very appropriate in my mind. They have a very large agricultural extension service, which has been in existence for over 100 years, with offices throughout the state with trained personnel who've over the last several years really expanded beyond agriculture into public health, nutrition, and other areas. And so it was a very natural focus for our state to have as the Regional Extension Center. So the Indiana Health Information Exchange works on a very close basis with the personnel that are growing, as these are all new organizations in the Regional Extension Center at Purdue University, in designing their programs, in particular with regard to connectivity, as the Regional Extension Center works with providers to select and implement electronic health records. A key component that the Regional Extension Center personnel carry with them as they think about that is the ability to be connected to the Indiana Health Information Exchange. So the cooperation there is really around what are the standards, what are the approaches, and providing the Regional Extension Center with education and insight into how the Health Information Exchange can facilitate the work that they're doing. And that in particular plays out as the meaningful use criteria have been finalized, and a number of those meaningful use criteria are functionalities that the Indiana Health Information Exchange can provide for as a component of a complete electronic health record or as a module. So quality reporting, for example, things like delivery of laboratory results into electronic medical records, those are all things that we can facilitate as well as others. And so making sure that the Regional Extension Center personnel are well informed about that process and able to take that information to the constituents that they're trying to help. The other major program, the Health Information Exchange Cooperative Agreement Program for the state, is a designated entity in our state is called eHealth, the Indiana Health Information Technology Corporation. And from the beginning, because of the strength that we've had for many, many years in Indiana in Health Information Exchange, not just the Indiana Health Information Exchange, but the Michiana Health Information Network and others, eHealth, the state designated entity in our state, has really focused on building co-opetition between those organizations, helping ensure that services are available throughout the state, that the state's needs are met, but doing that in a way that fosters the growth and in the depth and breadth of the existing organizations that serve citizens of the state of Indiana. So that's a very tight ongoing cooperation with weekly interactions that we hope will drive real value for the eHealth, or Indiana Health Information Technology Corporation, over the coming years. Patients are obviously at the center of everything that we do. Our entire reason for existence at the Indiana Health Information Exchange is to improve the quality, safety, and efficiency of care that patients receive. So they're critical. The way that we do that primarily, though, is by supporting the relationship between the patient and the provider. At present, the Indiana Health Information Exchange has no direct relationship with patients. We don't want to get in the middle of that relationship with their provider. We want to support it. While we certainly recognize the potential value that the aggregated patient-centric longitudinal data that's available through the exchange might have to a patient, we think we have a lot more work to do in terms of engaging the providers in our area who are the custodians of the patient's data that we have available, and the patients themselves in terms of understanding how best to take advantage of that information while supporting their clinician's relationship and, importantly, protecting the patient's privacy.